Hey folks, I apologize for my unkempt appearance. I just woke up. You're lucky you can't smell my breath right now, but I wanted to take this opportunity to talk about some cervical spinal radiculopathy. I've had an injury in jiu-jitsu recently that caused me to have a lot of tightness in the neck here, debilitating pain at first. It was awful. It was like Night of the Living Dead. I could basically just walk around my house and go, "Ugh," for like 72 hours. It was the worst thing ever. And that comes with a lot of radiating pain down the arm. It'll be different sections of the arm, and the neurologist will typify which nerve is being impinged by which fingers go numb. So for me, it was the dorsal thumb right here. So that means we're looking at likely the radial nerve, so like C6-7 area back here. So a lot of people will hear the dreaded sentence of doom, herniation, when this happens. The thing is, the good news is that it's not the death sentence that a lot of people used to think that it was. They've done a lot of large-scale systematic reviews of MRIs in the last 10 to 20 years or so that have revealed tons of people with all kinds of radiculopathy, all kinds of nerve pain, all kinds of symptoms like that, that have no herniations, and tons of people with tons of herniations that have no symptoms. So they're thinking it's not the root causative factor. Differential diagnosis for this can be impingement by a muscle, impingement by another structure, a ligament, a tendon. A lot of times the first rib here, if it's hiked up in a certain way due to soft tissue tensions, can impinge that nerve trunk. A lot of things can happen to cause that. But one of the things that can be a factor is tightness in the scalenes muscles right in here, the anterior and middle and posterior scalenes. Usually it's the anterior or middle scalenes that do this. So I'm going to show you guys a really simple pin and stretch maneuver that you can do at home that can take the sting out of this a little bit. It's not going to cure it completely, obviously, but it can make it suck less. That's the technical term, I believe. Okay, so to find your scalenes, you got these big tubey guys. That's the technical term as well, that come off of the mastoid process right here. These are your sternocleidomastoids. These are not the muscles that you're trying to look for, but they're a useful landmark in finding them. So you can get them right here. You can kind of strum on them right there. So if you move these guys out of the way, you're going to find some tight little cords right underneath your collarbone, right here, and that's where you want to pin them. And if you strum them a little bit, you can get some echo, some ripple, some lovely reminder of that awful, deep inner throbbing ache horribleness that you had when you first had your neck spasm or your cervical disc herniation or whatever it was. So what you're going to do with these guys is you are going to gently, easy there, killer. You're going to pin them just underneath your clavicle right here. These are for the middle scalenes, all right? Pin them right here. These are going to be just to the outside, to the lateral side of your SCM. You're going to pin them right here gently with your fingers, about a 20% effort if you want to quantify it that way. And you're going to come on over to the opposite side. This is not going to be a deep yogic type stretch. You don't want it to be, all right? You just want to get a little bit of pull, let up on your pin, and then come on back. Pin, little bit of pull, let up on it, come on back. It's like Brill cream, a little bit goes a long way. Okay, so for your anterior scalenes, we're getting deep now. So you're gonna move your SCM out of the way, you're gonna come down, it's gonna be right deep to the SCM, okay? So underneath the SCM, underneath your sternocleidomastoid, that big tubey thing. All right, you're gonna get underneath that. You're going to find it right in here, right at the point of your clavicle, okay? So when your clavicle does that little U-dip right there, it's going to be right at the point here. And you will know when you find it. It's like being in love, all right? So pin it gently right here. You're going to turn to the opposite side until you feel a pull. And then you're going to bring your ear toward that shoulder until you feel a pull. Okay, it'd be easier to see it from this side for that last portion. So I'm pinning here, turning to the left, and tilting my head just a little bit that way. Alrighty. One more time from the front, so you can get my good side. Pin right there, Turn the opposite way and tilt your head. And you're done. Hope that helps.